Let me ask you something, and I want you to really sit with this question for a moment. What if something was affecting your body right now and you had absolutely no idea? No pain, no fever, no obvious sign that anything was wrong, just your normal daily life going about your routine, feeling mostly fine while something silent was quietly doing damage beneath the surface. I know that sounds unsettling, but here's the truth that most men, especially men over 50, have never been told clearly enough. Some of the most common infections that affect men produce little to no symptoms in the early stages. And by the time something becomes obvious enough to act on, the window for the simplest treatment has already passed. My name is Dr. Reena. I've spent 12 years in clinical practice, and today I want to have an honest, calm, dignified conversation about 5 infections that men need to know about what they do to the body, what signs to watch for, and what to do if something doesn't feel right. This is not a video about fear. This is a video about awareness. And awareness, as I always tell my patients, is the most powerful medicine there is. Before we go any further, if this kind of honest health content is valuable to you, please hit the like button right now and subscribe so you never miss a conversation like this one. And drop a comment below. Tell me, where in the world are you watching from? I love hearing from this community. Now let's get into it. Here is the myth I want to bust right at the start of this video. Most men believe that if something is wrong, truly wrong, their body will tell them loudly and clearly. And so they wait. They wait for pain. They wait for something undeniable. They tell themselves, if it were serious, I'd know. But here's what 12 years of clinical experience has shown me over and over again. The infections that cause the most long-term damage are often the quietest ones in the beginning. They don't arrive with fanfare. They settle in gently, establish themselves, and by the time symptoms become hard to ignore, the condition has often progressed significantly. This is not a reason to panic. It is a reason to pay attention, to get tested, to have conversations with your doctor that you might have been putting off, because the men who come out of this the best are never the ones who waited for a crisis. They're the ones who caught something early and acted. As a board-certified physician with 12 years of experience working with men across a wide range of health concerns, I've sat with patients who were shocked to discover something during a routine screening, something they had no idea was there. I remember a patient, I'll call him Gerald, retired, active, felt great, came in for a general wellness check because his daughter insisted. During that visit, we ran a comprehensive panel, and we found something early, completely manageable. He walked out that day not with fear, but with a plan. That's the story I want for every man watching this video. Knowledge is not the enemy. Silence is. Let's walk through 5 of the most important infections that men need to understand what's happening biologically, what to feel for emotionally, and what it means practically for your day-to-day life. Number 1, gonorrhea, the one that hides in plain sight. Gonorrhea is one of the most common bacterial infections in the world, and it is curable when treated. That's the good news. Here's the part men don't hear often enough. A significant number of men who carry this infection have no symptoms at all. None. For those who do develop symptoms, the signs can include a burning or uncomfortable sensation during urination, an unusual discharge that may appear cloudy or discolored, or a persistent irritation that feels like something just isn't quite right. In some cases, there can be discomfort or tenderness in the testicular area, though this is less common. Biologically, what's happening is that the bacteria have established themselves in the mucosal lining of the urinary and reproductive tract, triggering an inflammatory response that the body is quietly trying to manage. Emotionally, because the symptoms, when they do appear, can feel mild or easy to rationalize as something else, men often wait too long. Practically, untreated gonorrhea can eventually lead to more serious complications, including effects on fertility and increased vulnerability to other infections. The curable part is important, but only if you catch it, and you can only catch it if you test for it. Number 2, HPV, the most common one nobody talks about. If there is one infection on this list that affects the most men and gets discussed the least, it is the human papillomavirus, commonly known as HPV. Here is something that may genuinely surprise you. The majority of sexually active men will encounter this virus at some point in their lives. And in most cases, the immune system handles it quietly on its own without any intervention needed. The body fights it off, and the man never knows it was there. But sometimes, in some men, it doesn't resolve on its own. And when that happens, HPV can produce visible changes in the skin of the genital area, or less commonly in the mouth and throat. In a smaller number of cases, certain strains of HPV are associated with increased risk for cancers affecting the throat, mouth, and other areas. Biologically, HPV works by integrating with the cells of the skin and mucosal tissue, sometimes causing abnormal cell growth over time. Emotionally, because the virus is so common and so often symptom-free, men frequently feel blindsided when it does show up. Practically, regular checkups, including attention to any new or unusual skin changes, are your best tool here. This one isn't about fear. It's about knowing what to look for and not dismissing changes you've never seen before. Number 3, syphilis, the great imitator. Syphilis has been called the great imitator, and that name is well earned. Here's why this one requires special attention. Syphilis progresses through stages, and at each stage, the symptoms can look like something else entirely. A skin irritation, a rash, fatigue, muscle aches, things that are easy to attribute to other causes, especially as we get older. And our bodies naturally have more of those kinds of days. In the earliest stage, the most common sign is a small painless sore called a chancre that can appear on the genitals, around the mouth, or in other areas. Because it's painless and because it typically heals on its own within a few weeks, many men assume the problem has been resolved. It hasn't. The infection has simply moved inward. In the second stage, the body may develop a rash, often appearing on the palms of the hands or soles of the feet, alongside fatigue, mild fever, and general unwellness. This again can feel like a dozen other things. If the condition progresses further without treatment, the consequences become significantly more serious, eventually affecting the heart, the nervous system, and other major organ systems. Biologically, the bacteria responsible for syphilis are highly adaptable and move through the body in stages, if not interrupted by treatment. Emotionally, the chameleon-like nature of this infection means men often don't connect the dots between symptoms. Practically, the answer is simple. Antibiotic treatment is effective, but it must be started, and that starts with testing. Don't let the silence of the early stages fool you into thinking the storm has passed. Number 4, chlamydia, the quiet one. If gonorrhea hides in plain sight, chlamydia hides in near total silence. Chlamydia is the most common bacterial infection of its kind, and the vast majority of men who carry it have no symptoms whatsoever. For those who do, the signs tend to be subtle. A mild burning during urination, a slight discharge, and occasional discomfort that comes and goes. Easy to dismiss, easy to wait out, easy to forget. Biologically, chlamydia is a bacterial infection that targets the cells of the urinary and reproductive tract. Because it produces so little immune response in many people, the body doesn't mount the kind of visible fight that would make symptoms obvious. Emotionally, because nothing feels dramatically wrong, the idea of seeking testing can feel unnecessary, even excessive. Practically, left untreated over a long period of time, chlamydia can contribute to complications that affect the reproductive system and overall health in ways that take years to become apparent. This is the infection I talk about most often when I'm trying to explain why routine testing matters even when you feel fine. Because this one, more than almost any other, is specifically designed by biology to go unnoticed. If you haven't been tested recently, this is the one that makes the strongest case for why you should. Number 5, genital herpes, the one surrounded by the most misunderstanding. I want to talk about this one carefully because it carries more stigma than almost any other infection on this list. And that stigma causes real harm. It stops men from getting tested. It stops them from having honest conversations with their doctors. And it leaves them more vulnerable, not less. Here is what I want you to know. Genital herpes is caused by the herpes simplex virus. A virus that once present in the body remains there in an inactive state between outbreaks. The first outbreak, when it occurs, can be the most pronounced, sometimes including fluel-like feelings, localized discomfort, swelling, and the appearance of fluid-filled sores in the affected area. After that initial episode, many men experience far milder recurrences or none at all for extended periods of time. Here is the part that makes this infection particularly important to understand. The virus can be present and transmissible even when no visible sores are present. This means that many men are entirely unaware they carry the virus and may have been for years. Biologically, the herpes simplex virus establishes itself in nerve tissue, reactivating periodically in response to stress, immune changes, or other triggers. Emotionally, the stigma attached to this infection causes enormous psychological weight, shame, fear of rejection, isolation that is completely disproportionate to its actual medical impact in most people. Practically, antiviral medications exist that significantly reduce the frequency and severity of outbreaks and lower the risk of transmission. This is a manageable condition, but management begins with awareness. You are not defined by a diagnosis. You are defined by what you do with information. Here is what I want every man watching this video to take away. Simple, clear, and completely doable. First, get tested. Not when something feels wrong, routinely. A comprehensive screening panel that includes these 5 infections takes very little time and gives you clarity that you simply cannot get any other way. Second, pay attention to changes. New discomfort, unusual discharge, a sore that appears and seems to heal on its own, a rash you can't explain. These are your body's way of flagging something worth looking at. Don't rationalize them away. Third, talk to your doctor honestly about your health history, about any concerns you've been sitting on. The conversation that feels awkward is almost always the most important one. Fourth, understand that treatment works for the bacterial infections on this list. Antibiotic treatment is highly effective when started promptly. For the viral ones, management options exist that genuinely improve quality of life. Early action always produces better outcomes than delayed action. And fifth, release the shame. These are medical conditions. They are not moral failures. And every man who comes forward, gets tested, and takes action is doing something genuinely brave, even if it doesn't feel like it at the moment. I want to speak directly to you for a moment, man to doctor, friend to friend. If something in this video resonated with you, if a quiet concern has been sitting in the back of your mind that you haven't known what to do with, if you recognized a symptom or realized you haven't been tested in longer than you care to admit, I want you to hear this. There is no shame in where you are. There is only the decision about where you go from here. The men I've seen navigate health challenges with the most grace and the best outcomes are not the ones who never had anything go wrong. They're the ones who chose awareness over avoidance, who chose action over silence, who decided that their health and their future was worth fighting for. That choice is available to you right now. Here is what I know to be true. After 12 years of sitting with patients, listening to their stories, and watching what a single piece of timely information can do for a man's life, age is not the end of health. It is not the end of vitality, of confidence, of living fully. It is simply a chapter that requires a little more wisdom, a little more willingness to listen to your body and act on what it tells you. You have that wisdom. You're here. You watched this entire video. That already says something about the kind of man you are. If this conversation gave you something today, if it sparked a thought, prompted a decision, or simply made you feel a little less alone in something you've been carrying, please hit the like button. It costs you nothing, and it helps this message reach the men who need it most. Subscribe if you haven't already. Every week, I bring you honest, practical, dignity-first health conversations designed specifically for men who want to live well, not just long. And please leave a comment. Tell me which of these 5 surprised you most, or simply tell me where you're watching from. This community means everything to me. I'm Dr. Reena. Take care of yourselves, gentlemen, because you are absolutely worth